Hey guys, it's Jill Mitchell, Doctor of Physical Therapy, owner of Thrive Physio and Wellness, which is a mobile concierge PT practice here in Dallas, Texas. Hope everybody is having a great week. It is Wellness Wednesday, where I talk about various either general health topics or more specifically related to physical therapy, whether it's pain related, whether it's exercise related, injury related, you name it. I asked a question as far as ideas of things that people had questions about, and so I'm definitely, please feel free, go back and post any burning questions you might have that I can do a future post on, or you can also comment below about that. But today's topic, as requested, is all about knee pain, which is a really big topic. I'll just start with the fact that knee pain won't be addressed just in one post, so there will be some future posts about knee pain. I'm going to speak kind of more generally today about some things that kind of are common amongst all different types of knee pain. And then we'll go from there. So, I do kind of have some notes today just so I don't forget, because I have a tendency to forget things I want to say. So the first thing that I want to talk about is really not unique to knee pain, but it is a really important concept that I know physical therapists are very aware of, but I do think it's important for the patient or the active person to know about when you're facing a pain issue. And so while I'm talking about knee pain today, this can apply whether you're having pain, whether you're having headache pain, whether you're having shoulder pain, back pain, whatever. And so that is the concept of victims and culprits. So victims and culprits, what do I mean by that? So when you come in for a physical therapy evaluation, it should be a thorough evaluation. You may come in for knee pain, but you need to look at the whole body, how it's moving as a system, because your knee pain could just be the victim, meaning that you have pain there, but the problem or why you're getting that pain, the culprit is really elsewhere, meaning it's not in your knee. The problem that could then improve your knee pain is actually maybe in your back, in your hip, in your ankle. And so just realizing, hey Travis, thanks for watching Mom, thanks for watching Eric, but realizing that there are victims and culprits. So yeah, it's a great concept someone taught me once. So realizing victims and culprits, that when you have knee pain, you can address your knee pain, but if you don't address the culprits, you're likely gonna have that issue again. So let's take a super common example, an extreme example though, but it's a really common surgery. Hi Eric. Is a knee replacement. So, which is a really common surgery. They're happening more and more. I would probably argue they're happening too quickly these days. And people don't go to physical therapy when physical therapy could actually fully solve your issue without surgery. And some people may go to surgery just to satisfy the requirements in order to get the knee replacement. Well, knee replacements aren't fun, they're painful, and you still have to go to physical therapy. So, but my point back to victims and culprits is, if you get a new knee and you have a new joint, so maybe your pain is gone, but you haven't addressed the culprits which are actually elsewhere, you may still have a problem. It may still be in your knee, or it could be somewhere else. Your knee could be also the culprit. It could sometimes be the victim and the culprit, meaning there's more than one culprit. But so when we're talking about your knee, I kind of say it's the victim between your hip and your ankle, because again, you're looking at the joint above and below, often maybe even more than that, but I say it's, like I said, the victim between your ankle and your hip, which basically means, so in your ankle, an issue you might have is a lack of mobility in your ankle, most often meaning lacking dorsiflexion, which is your ability to bring your nose towards your shin. So the mobility of that joint is less. Or you could have the opposite problem, and maybe you have a long history, multiple ankle sprains, and you have an instability in your ankle, meaning your ability to kind of lock in that joint and hold it stable. Yes, it is. I completely agree, Travis. That is often a super painful spot, but so your ability to lock in your ankle, if you've had lots of ankle sprains, could be playing into why your knee is hurting. So knowing what your past injuries are is a really important thing to know. And then going up to your hip, so it's really not just your hip, but your hip, it's usually pretty stable. It's more often a lack of mobility in your hip, but that's not always true. But when you're talking about stability with your hip, you're usually also including your back, or what we call your lumbopelvic hip complex, long wordy term, but basically it means how you're able to stabilize or keep it locked in your back, where your pelvis, and then where your hip and femur all meet together. Which, if you think about that, if you're a runner, that's really important. So that can be an issue with various types of knee pain with running. So if, again, you just look at the knee and you don't address those other issues, you're likely gonna have a problem. So that's one takeaway that I just want you to know, is the concept of victims and culprits that you often need to be addressing more than just the area of the pain. And I think that's really important to know. So then we're staying really general and kind of simple today, but this is something, and it is a really simple next topic. It has to do with your range of motion. So when you come in for a physical therapy evaluation and we figure out kind of what's going on, I'd come up with a game plan and I'd present this game plan to you. Not everybody will have to start at this point, but the starting point is your mobility. So at its simplest, it means what your range of motion is, which if you don't have optimal or normal range of motion, that can be, you could be doing that because it's painful and so you're kind of guarding. But that can play into your pain. But mobility does also have to deal with like the joint mobility, which kind of in big picture becomes what your range of motion is. But your joint mobility is also playing into your mobility, but that is something that's a little bit harder for someone to do without guidance of like a physical therapist. So, but we're going to talk about your range of motion. So whether you are having knee pain and you are a high-level athlete, whether you're having knee pain and you can barely get off the couch, your range of motion may be a factor and it may be a starting point. It is a really simple concept that I think the higher level person may forget at times, but if you start having pain, I think it's a good idea to kind of check what your range of motion is. It's not hard to do, but making sure that it's optimal and affecting it that way. So, range of motion of your knee. What is normal? So normal, I'm going to throw out numbers. The numbers don't really matter, but you know, some people want to know. So extension, or your ability to straighten your knee, technically it should get to 0. meaning you can lay it completely flat. I'm gonna move the camera back in just a second, but you should be able to get it flat. And actually, people always talk negatively about hyperextension of your knee, but a little bit of hyperextension is technically normal. About 5 to 10 degrees is considered to be normal. And if you're somebody that has had like an ACL repair, we actually strive to regain that hyperextension, because if you don't, sometimes that can create a problem. But so for our purposes right now, it's 0, and then your bending or your flexion, that's a little bit more open. A surgeon, if you were having some sort of surgery, would be happy with 120 degrees. But technically it's up to, the norm ranges can vary up to 150. And so really your normal would be what your other leg is. It's really optimal to get them to be the same. So if you're having pain in one knee, your comparison or your test is for normal is your other leg. If you're having pain in both knees, and you don't have a knee range of motion problem, I might be a little bit surprised, but depending on how long the issue's going on. But I would say go with your knee that hurts worse, or sorry, that hurts less, and maybe you've had that issue, like which one came first, and use the one that hasn't hurt as long as more of the norm. But so then the other factor as far as bending your knee that you have to consider is there is a range of normal, because we don't all look the same. We have different lengths of bones. We have different muscle bulk in the back of our legs or meat on us. So it would depend on like the size of your hamstrings and your calf, and then even your quad. But a super simple thing you can start with that can actually have a really good influence on your actual pain is just optimizing your range of motion. There's lots of different ways to do that. I'm gonna do something that's really simple, and then I'm gonna talk about something that is helpful, particularly for the straightening. So I'm gonna move the camera back, bear with me. And Rocky's gonna get a little bit disturbed. But I don't know that you can see that. So hopefully sitting on a table. So can you see that? So when you're testing like yourself, you should be able to get your knee flat to the mat. You shouldn't be able to put your fingers beneath I can't tell if you can see this or not. Hi, Rocky's making an appearance. You should be able to get your knee flat to the mat. That's your extension. If you can't, that's not really normal. Granted, there are those people who have never been able to. That might be a different factor. I'd still try to optimize it though. And then the other part is your ability to bend your knee, trying to get it as close to your butt as you can. So if I don't have a knee range of motion issue, but laying flat, you may need someone to help you kind of look at this and see, do I have a lack of range of motion? So if you do have a lack of range of motion, depending for this part, regardless of whether it's the straightening or the bending, I would do this one for both purposes. And it's a super simple exercise that if you're post-surgical knee, you've probably done this exercise. This is just an old gait belt, but I would use some sort of strap to assist you, whether it's an old gait belt, whether it's a dog leash, whether it's the strap around your robe, whether it's a sheet, whatever. I would lay down, and then all you're gonna do is literally slide your heel. It's a heel slide, and then you're gonna give it a tug at the end. Again, this is more for the bending, to try to get it to where it's equal. It may be uncomfortable, particularly if you never go there. And so I would hold it at the top for 10 seconds. I would then also go all the way down, push your knee down, trying to get that straightening, tighten your quad muscle, hold that for 10 seconds, and I just do it 10 times. Depending on how severe this issue is for you, I mean, if it's a mild issue, you may have to do this one time and you're fine. So that's a pretty typical thing to have experience with. But again, I do think that maybe higher level people don't think about their end range of motion all the time. And so just making sure that it's optimal is beneficial and can have an effect on your pain. So now I'm going to talk about something that's maybe a little bit nerdy, but is more having to do with your ability to straighten your knee. So you have to think about the things that may be affecting your ability to straighten your knee. And so one of them could be both like the muscles in the back of your knee are kind of tight, and so that's affecting your ability to straighten your knee. You could do the traditional stretch. Stretching is a little bit controversial these days. You had ACL surgery. That you definitely did that exercise if you had ACL surgery. But so people that, particularly if you've had surgery, like you have knee pain, but you have a past history of knee surgery, I'd still check your range of motion even later. That could be playing into active, so you never got your range of motion back? That's interesting. Okay, I'm going to come back to that. But, so you could do a stretch so first of all, your calf or your gastroc attaches above the knee joint. So that is something to consider. And then your hamstrings attaches below your knee joint. So both of those could be influencing your ability to straighten your knee. So you could try a just typical calf stretch, hamstring stretch. Those are pretty simple. I actually wasn't planning on demonstrating them because I'm kind of give you an alternative idea. So there's something called the concept of reciprocal inhibition. And so it's a fancy word, but basically it means when you contract one muscle, so I'm contracting my bicep, the opposing muscle or the antagonist has to relax. So when I contract my bicep, my tricep has to relax. So an option for trying to affect your knee range of motion would be for both your gastroc and then your hamstring would be activating or contracting those opposing muscles. So for your gastroc, it would be your anterior tib. So it would be literally not just passively doing it, but literally actively trying to pull your toes towards your nose, your whole foot really, and you're using your anterior tib. So just kind of maybe pumping it, doing it 20 times, and then trying to relay your leg down, see does that affect anything? And then doing something like a long arc quad where you can't really see, sorry, having camera, but a long arc quad where you're straightening your knee, so you're activating your quad muscle. If this is kind of painful to your knee, you could always try a short arc quad, or you could even just try like doing a quad set. But then, so doing a round of that, I typically try to like hold it for 5 seconds, do at least 10, maybe 20, and then relay your leg down and see does that affect your range of motion. So that's kind of the second takeaway, is just super simple. First step is making sure that your range of motion of your knee is optimal. There are other ways to do it. A heel slide isn't the only way. If your knee range of motion isn't optimal, like if you had an ACL surgery and you never got optimal range of motion, there's so many different factors. It's really hard to talk about that, so I'd really want to know history more, because there could be certain factors that you may not actually get your range of motion back. But yeah, so the first step would be optimizing your range of motion. Again, whether you're a high-level athlete, you might find that's just so easy. Like, of course I have normal range of motion, but like, when was the last time you checked your end range of motion? And again, somebody that's high level, you may have to do it like once or twice and you're done. If you're having like a chronic osteoarthritis problem and you're contemplating a knee replacement, if you can improve your range of motion, and you're destined for a knee replacement, you're going to set yourself up for a better outcome on the other end. But you more than likely will affect your pain to some degree if you can optimize your range of motion. So that's the second thing. Range of motion, super simple, but I do think it's for both ends of the spectrum, more sedentary or not very active person and a super active person. And then the next thing I want to talk about, I'm just going to actually talk about it because I actually did a Facebook Live about it already. And that is your hip strength. So your hip strength is a huge factor with knee pain. I would say that I'm probably more surprised when someone presents to me with knee pain and they don't have a hip strength issue to some degree. I mean, it might be really mild, but usually there is some sort of hip issue to a degree involved with knee pain. So strengthening your hip would be another exercise to do. So if you go back to that post, all of them are very foundational type exercises. They're really simple. They're not where you end up. They're where you start. Because they're all an open chain, which basically means your feet are off the ground. And in most activities, your feet are on the ground. So we also want to strengthen when your feet are on the ground. So those are just foundational exercises. But that is a key piece, early piece for knee pain. So I recommend go back and watch that post for some specific exercises, starting point for hip strength. And then the last thing that I want to talk about is actually, so I'm going from super simple range of motion to this is actually not the next step, but it's partly a test, but partly it's also a really good exercise and can give a lot of information, and I think it's super beneficial. And so it's single limb loading, or it basically means standing on one leg, but it's not that simple. So bear with me, I'm gonna try to turn the camera. Whoa, I can't do that. It won't let me do that. Shoot. Okay. Well, let's see. I might have to move the table. Sorry, technical difficulty. I don't think you're going to be able to see. Actually, let me lower it. So it's partly a test. You probably won't be able to see my full leg. Kind of. So basically, you're standing on one leg. Of course, it's not that simple. I don't want your knee to be straight in this. Let's see if I can lower it so you can actually see better. That's a little better. So you're gonna I'm gonna stand to the side to start with. You're gonna be in about 30 degrees of knee flexion. So a pretty good bend. You've got your foot planted. So your foot, like, it's even spread in your foot. You're not like sitting in your heel. You've got your feet nice spread out. You're even in your foot. You've got your knee bent and you're sticking your butt out just a little bit. And then you are kind of keeping your abs engaged. So the question is, can you do it? So it's a test. It really shouldn't cause pain. So again, this is not the next step. So you may not be able to do this. So try it. A, can you even do it? You should be able to get on that foot, again, bending your knee, you're not locking out your knee, and hold it. Particularly, I mean, single limb loading is basically running. But a couple things that are, I use this as a test for a lot of things, but I also sometimes have someone lower down on a step that gives more information, but this all plays into knee pain and other issues. So great test for lots of things, but you're bending your knee. A, can you stay stable? Are you is your body all over the place? Hi, David. Is your hip, so think of your pelvis and the bones right here as headlights. Can they stay stable and they're pointing forward and you can just maintain it? I'm on one leg right now and I'm solid. The other thing would be, I really wish I could turn my camera to the side, but I can't right now. So, having a technical difficulty here. I'm gonna turn this and lower it a little bit more. There we go. Oh. Okay, so does your knee cave in? And I can't do it because I don't really have this issue, but so you're staying stable here, you bend your knee, and you're able to maintain that without knee pain. You can hold it, you're solid, you're not all over the place, and your knee's not caving in. So it's not only a good, I'm just going to bring this back up. It's not only it's a good test, gives a lot of information, but it is a good exercise. Again, I went from range of motion to this exercise. This is not necessarily the next step, but I don't really know what your knee pain issue is. This might not be appropriate for you. So if you're getting a lot of pain when you're doing this, I just cut it off right now. If you're just getting burning in your quad or your hip, your butt, that's good. That's normal. So I think single limb loading is a great exercise. There's lots of different ways to progress that. But it also gives you information. So if you're having an issue, you try it and you can't even do it, that I would say don't worry about it quite yet. And I would go back to the hip strength exercises and at least start there. That's not likely the only thing. But I am also trying not to be super long with my post. I think I already failed, but then if you also, your knees caving inward or you're not able to stay stable with your pelvis, meaning your headlights stay where they are, I would say you likely are having a stability issue in that lumbopelvic hip complex. And the starting point is also, or one of them is hip strengthening. So those are kind of my takeaways for today. So it was 4 things, just making sure I covered everything I wanted to cover. Going back to the single limb loading. If you find that is a good exercise, I would just try, you're not having pain, you're not all over the place. I would just try holding it for at least 30 seconds, and that's your exercise. You should find that your quad and your hip are kind of working together and they're burning pretty good when you're doing it. So now to wrap up, the takeaway points are understanding the concepts between a really important concept of victims and culprits, and realizing that your knee pain may just be the victim and that you've got culprits. Maybe a culprit is your knee, but it may also be other areas like your ankle or your hip or your back. So that's a really important concept to just understand. And then just understanding knee range of motion. You want normal or optimal, and that could be playing into your pain. And range of motion is an early thing to work on, and it's one of the first things to work on. Some people don't have that issue, and if you, I don't have that issue. So if you find you check it out and hey, it's all normal, then you move on to the next thing. That's not really something you have to worry about. And then the next thing is just understanding that hip strength is definitely a factor in knee pain. And so I did a Facebook Live about hip strength and just how important it is in general. And so going back to that Facebook Live, there were, I believe I did 3 exercises that were all good foundational type exercises to start with. And then the last takeaway or last piece that I talked about was just single limb loading, which is basically standing on one leg, but your knee is not locked out. It's got a pretty good bend to it. Your butt's sticking out backwards. And then it's a test. Can you do it? If you're getting a lot of pain, that's probably not appropriate for you at this time. But then if you have trouble doing it and you're all over the place, you likely need to at least start with the hip strength as one piece of it. But then if you can do it, but you just can't hold it for very long, it's a good exercise to do. So that's all I have for today. I do promise this is not the only post I would do about knee pain, because it is a really diverse topic. But I hope you found it helpful. I would love to hear your comments, your thoughts. If you have a specific knee pain issue, even hearing about that, you could post it below or send me something private. It kind of gives me information of things to talk about. If you want to talk to me about your knee pain issue, I would love to be a resource for you. I can also do a consultation, whether it's like a telehealth Zoom call if you're not in the local Dallas area, or if you're in the local Dallas area, I would love to do a consultation with you to help you get on the right track in regards to your knee pain. So that's all I have for today. Thank you so much for watching, and I will see you guys next time. Have a great one. Bye.